The key aspects of a legally defensible collection and chain of custody are 1. A completed, legible, and signed chain of custody. 2. Direct observation of the specimen being produced. 3. Sealed specimen with donor's initials and the date on the specimen seal. Date, initials, and barcode number must match chain of custody. 4. Seal placed in a manner that would make any tampering evident. The step-by-step procedures needed to accomplish these 4 points will be illustrated. Failing to perform or failing to perform correctly any of these steps could invalidate the defensibility of the test result in court and compromise the goals of the agency's drug testing program.
The donor must abstain from smoking, drinking, and eating for 15 minutes prior to specimen collection. If they have done any of these, have them wait 15 minutes before collecting the specimen.
Good morning.
When the donor comes in, the first step is to identify the donor using a picture ID, such as a driver's license or government-issued ID, and asking what agency the donor is testing for. Verify that the picture and name on the ID match the donor.
Have you eaten, smoked, or drank anything in the last 15 minutes?
Nope.
Ask the donor if they have smoked, drank, or eaten anything in the last 15 minutes. Select a NORCM chain of custody form and verify that it is the correct form for the client that the donor is testing for if you are performing collections for more than one NORCM client. Using the picture ID, fill in the required information on the chain of custody form. Ensure that the information is legible and the identification case numbers are in the appropriate box. Open the outer package and remove the tube and the collection device package. Open the collection device package so that the donor can take the collection device and place it in his/her mouth. The collection device should be placed under the tongue.
Please do not suck, chew, or speak while the collection device is in your mouth.
Instruct the donor not to suck, bite, or chew on the device or speak while the collection device is in their mouth. The collection device should be left in the donor's mouth until the indicator window on the shaft of the collection device turns blue, about 2 to 3 minutes. When the indicator turns blue, open the collection vial and hold it in your hand. Do not dump out the buffer and do not set it down, as it is subject to falling over. You should wear gloves as saliva is considered a biohazard. Have the donor remove the device from their mouth and place it in the collection tube. Place the top on the tube and make sure it snaps shut. Visually inspect it to make sure it is completely closed and turn it upside down to make sure it does not leak. It is not necessary to fill in the label on the collection vial. Peel the specimen seal off of the chain of custody form and place it over the top of the collection tube and down the sides. Have the donor initial and date the specimen seal. Mark the observed box on the chain of custody form. Note the collection time and select the appropriate test panel. Again, it is critical that all information on the chain of custody is legible to ensure a legally defensible result. Have the donor read and sign the chain of custody form. Make sure that the barcode, initials, name, and signature all match, and that all dates on the chain of custody form are the same. If the signature is illegible, have the donor print their name above the signature. Once you have verified all the information on the chain of custody, sign and date it. Place the specimen in the smaller compartment of the specimen bag that contains the absorbent pad. Do not remove the absorbent pad. Tear off the perforated edges of the chain of custody form and separate the original white copy to be sent with the specimen. Fold the chain of custody once for the half-page form, twice for the full-page form, and place in the larger compartment of the specimen bag. Fold and seal the bag as indicated on the bag by placing the glue strip over the black hash-marked portion of the bag. Do not roll the specimen bag like a cigar, and do not use rubber bands or tape to secure the bag. The completed specimen bag should appear like this. At this point, it is ready for shipment. If it will not be shipped for more than 3 days, place the specimen in the refrigerator if possible. The specimen is now ready to be placed in the appropriate shipping bag or mailer box. Both the courier bag and the DHL bag can be used to send multiple specimens.
To review, the critical aspects of a legally defensible collection and chain of custody are 1. A completed, legible, and signed chain of custody. 2. Direct observation of the specimen being produced. 3. Sealed specimen with donor's initials and the date on the specimen seal. Date, initials, and barcode number must match chain of custody. 4. Seal placed in a manner that would make any tampering evident. Following these procedures will ensure that the results will be defensible in court and will be supportive of the goals of the agency's drug testing program.